Ola,
Here.
Hankins,
Here.
McInnes,
Here.
Kuntz,
Here.
Calarito,
Here.
Mason.
Here. Good afternoon, everyone. Thanks for making the drive to Charlevoix the Beautiful. Item number 3 is our review and approval of the meeting minutes from October 4th, 2022. If you will look on your second page under Finance Committee, Jennifer advised me that the numbers need to be changed. The September bills amount should actually be $951,869.89. And the September employee expenses should be $29,767.62. So,
Mr. Chairman,
sir,
the middle of the first page, request for proposal for legal counsel. I would like, it's a roll call vote and it says Chairperson Scott Hankins. I would like Chairperson Stricken. It's just not, it's not appropriate right there. There's a lot of things that the chairperson has to do, but that's not necessary in that instance.
okay. I'm fine with that being removed.
And then I have a question on,
were you through with the numbers though, Scott?
Well, before we,
Oh,
before
okay.
we move on, Jairus, Jennifer, on this, will you give me a corrected copy to sign?
Yeah, I'll send it to both of you and sign now.
Okay.
Yep.
Okay. That's fine. Jairus.
yeah, the second page, closed session pursuant to MCL 15.268. Did we have a motion to go into closed session?
We did not, and I watched it a couple times. There was no motion.
That's not good. That's not proper. And that's not on you, Scott. That's on all of us.
I don't know what happened there, to be honest with you. If we,
I didn't notice it until I read the minutes. I didn't notice I was sitting here with all the rest of you. So it's done and it's over with, but
Right.
we did go into closed session, so I don't think that the minutes are improper in that.
But you have to have a
but-
motion to go into.
To go in, right? I don't know how we unring that bell. Board, any input?
I think we don't. I think we learn a lesson. I think that's about the main thing, but that is an important point. I don't like verbal motions to begin with. I don't want to burden staff with an additional task. We in Emmett County made it specific that all of our motions start out in writing with very few exceptions, and this helps solve that. I'm not prepared to ask staff to do that, but it's useful to have all of our motions in writing. And that way it's clear. In fact, the county, its motion has to be in writing with a recommendation from the administrator and a legal review. I don't know that I want to offer to subject us, but I think that's something we have to remember.
I think we have, a technical problem, not an intentional problem. By that, I mean, we were going into a personnel review situation at the time. I will acknowledge that, yes, we should have had a motion to do so. And I'll note my apology in today's minutes that I guess I completely slipped through the cracks, and I'm not making an excuse there. I'm just stating that it did take place, and you're correct in bringing it up, Jairus, and having it noted.
Mhm. Would it be appropriate? So in these meeting minutes, I could say that we neglected to do a closed session motion and we all agreed to it at this meeting, that we agreed to it at the other meeting.
Well,
I honestly don't know how we correct this, and I think you're right, Charlie. We can't unring the bell. It's something that occurred. And we can strive to make sure that we don't do that. If you guys find me headed in the wrong direction, stop me. Okay.
Well, we didn't, the motion, not having a motion was significant. We did follow the rule. I mean, the law governing the closed session specifically permits, and we had a discussion about it previously, a closed session for the purpose of a personnel evaluation, which is what we had, what we did. And during our discussion, I believe we also specified who would be in the meeting. So I think that was done. We did not violate the Open Meetings Act when we went into the closed session. We failed to make the motion, but we followed the purpose
I
of
think
section
we
8.
followed the intent of
The intent,
law.
right.
Yes.
So I
Yes,
think
okay.
from that regard, we're okay.
So Jen, you've got a lot of words there to pare down. into
I got you
minutes, but-
covered.
Okay. All right, Jairus, are you done?
I'm done. I'm prepared to make a motion to approve the minutes as corrected.
Second,
Moved by Commissioner Rubin, seconded by Commissioner McInnes. Is there any further discussion? Hearing none, let's have a roll call vote, Jen.
Roloff,
Yes.
Hankins,
Yes.
McInnes,
yes.
Kuntz,
Yes.
Pallarito,
Yes.
Mason,
Yes.
Rubing,
Yes.
Marcus.
Yes.
Thank you.
Now, item number 4, review and approval of the agenda. You received a second agenda after the first packet because Dan and I had a conversation about adding item number 7 to it. But does everyone have the current agenda, which includes item number 7, the sanitary board decision notification?
Yes.
Everybody have that agenda? Okay. So I would take a motion for the approval of today's agenda.
I'll make the motion to approve the agenda.
Moved by Mr. Pallarito.
Support.
Supported by Mr. Rubing. Any further discussion? Hearing none, Jen, if we can have a roll call, please.
McInnes,
Yes.
Kuntz,
Yes.
Pallarito,
Yes.
Mason,
Yes.
Rubing,
Yes.
Marcus,
Yes.
Roloff,
Yes.
Hankins.
Yes.
Thank you.
Thank you. Item number 5 is public comment. Ladies and gentlemen of the public, our rules are posted along with our agenda. So keeping those rules in mind, does anyone wish to address the board? Do we have a sign-in sheet today for? Okay, there's right on the desk directly across from me, there's a sign-in sheet, but if you would just, sir, if you want to come up first and go ahead and sign in there, please, I'd appreciate that. Oh, you did sign in? Okay, go ahead. Let's make sure your microphone is on.
Okay,
If you would state your name and where you live, and then you have 3 minutes, which Mr. Pallarito is going to time for us.
all righty, thank you. My name is Hal Wolf. I live downstate most of the time in Ypsilanti, but up here I have property on Cedar Lane in Eveline Township on Lake Charlevoix. Thank you for the opportunity to address all of you. This is a very minor issue, but unfortunately, it's actually extremely important to me. My family has had property on Lake Charlevoix for 55 years. I inherited about 5 years ago after my mother passed away. It's very rustic. It's wooded. We have an RV trailer that we use, and we use it year round. That would not normally be legal, but we have a grandfather privilege based on the zoning ordinances that allow us to do that. There's an outdoor bathroom with a septic system, and we've used this without any issues for many, many years. I realize this is an antiquated lifestyle and it's unorthodox, but it's the way my family has chosen to live. And I am trying to live that same way with respect for my neighbors and the environment, but I've also tried to make some improvements. One thing we've never had is a well. And so a year ago, I looked into it and I thought, well, you know what, maybe that would be reasonable. So I did apply for a well permit. Well, what I didn't realize was that our septic system, and it's not meeting the current size code standards, but it hadn't never been registered appropriately because I don't know if my parents knew that that was even something that was supposed to happen. When we bought in 1967, I don't know what they knew and what they didn't know. So I run into that as a stumbling block. It's the application started a string of unfortunate events and some very uncomfortable accusations directed towards me that I didn't think were entirely fair. And they've been very hurtful to me. And I'm trying to figure out a way to resolve this situation. I've been in communication with Jeremy recently, and I've been told that the only procedural solution now will be to go to court. And I'm hoping to avoid that. I've had to go to court with the township to get permission to modify a lot line. I won that case, but it was painful, and I don't want to do that again. So I'm hoping that the information I provided to Scott and Shirley and also to Jeremy, that with whatever support I can get, that we could potentially come to a solution that doesn't involve litigation. Thank you very much. That's all I have to say. I appreciate it.
Thank you, Mr. Wolf. I saw another hand over here as well. Ma'am, if you want to come up and sign in if you haven't already, and then state your name and where you live, and you'll also have 3 minutes.
Hi, my name is Brenda Colvita. I live in Emmett County. Since this board's last meeting, the CDC added COVID-19 vaccines to the list of recommended vaccines for school children. The CDC announced in January 2022 that COVID-19 vaccinations do not prevent transmission of the virus, nor do they prevent one from getting the virus. So why recommend it for children who are largely unaffected by COVID-19? More importantly, adverse side effects such as blood clots and myocarditis and death even from the vaccine are still being studied. The public health field has backed away from the transmission claim, yet the Michigan Department of Health and Human Services has not. Why not? As of February 2022, the state of Michigan spent $62.6 million in state and federal taxpayer funds on television, social media, and radio ads. These ads tell Michigan residents to get vaccinated to prevent the spread of the disease. The admission that COVID vaccines do not prevent transmission of COVID was made months ago, yet MDHHS continues to advertise these false claims. Why is the top health department in Michigan pushing the use of a vaccine that does not work to prevent the disease? Why is this health department stating on its website that everyone should stay up to date on their boosters? It's no wonder public confidence in our medical institutions is at an all-time low. That lack of confidence extends to this health department as well. On your website today, there's a statement saying, quote, "Getting a COVID-19 vaccine after you recover from a COVID-19 infection provides added protection against COVID-19, unquote. If this health department believes that COVID-19 vaccinations work as a therapeutic, then why are they not advertised as such? Honesty is all we ask for. We, the people, deserve it. We actually demand it. Thank you.
Thank you, ma'am. Good afternoon, Ms. Moore.
Well, good afternoon, everybody. Hang on. Lots to cover, so I'm going to kind of go fast. Thank you, first of all, very much for posting the packet on the website. Much appreciated. I was able to share that. I have comments for you guys on 5 of the reports that were filed. Please take them in a friendly way. I sometimes sound like I'm advocating because that's what I've always done, but this is friendly advice, okay? First, on the health officer report, could you please give us more detail regarding your group discussion with MDHHS this past month about COVID-19 lessons learned? I'd also like to hear what was discussed regarding sustainability. Second, on the medical director report, could you please address the marijuana use? That is the only substance where the use actually increased according to the charts that were included in the report. I don't care so much if a teen is driving after smoking a cigarette, but if they're smoking marijuana, that's a whole different story. My understanding, especially reading Alex Berenson, is that marijuana does lead to psychosis. It's a gateway for crime and for meth, which both to help destroy families and neighborhoods. The health department should be fighting the presence of marijuana, in particular tooth and nail, in my opinion. Third, on the Community Health Services Report, the first paragraph of that report reads to me, okay, understand this is to my view of things, that 3 of my state government agencies find it important, and that's the word that was used, to interpose 3 public health professionals between parents and children in public schools. And that report said that the services provided should be acceptable to the youth. I would argue that those services should be acceptable to the parents. Just a friendly reminder that parents do not want their kids to be provided abortions, gender transitions, or sexual advice without their express involvement and permission. Communist systems seek to separate parents and children, but not American ones. Okay. Fourth, on the Family Health Report, it says we are providing trustworthy information to families with babies and young children. That's laudatory. We want to do that. However, if the department is recommending the COVID vaccine to anyone anymore, particularly young children, I would say it's not trustworthy advice. The Florida Surgeon General guidance no longer recommends the vaccine. A Pfizer representative just admitted under oath in the EU that there was never any data underlying the claim that these vaccines prevented transmission. And of course, CDC Director Rochelle Walensky just got COVID after her 5th shot. Lastly, on the CHIR report, this was focused on affordable housing to my reading of it. Is this really a health department responsibility? I recommend you examine the CHIR activities closely. As an agency, it operates in 31
seconds.
counties in northern Michigan, and it combines the authority of government, business, healthcare providers, banks, insurance companies, and community members all into one big ball in order to facilitate change based on health equity. It's kind of a little scary, and I just challenge you with a friendly challenge to make local decisions to protect our local counties and not go lockstep with a big centralized central planning on healthcare. That's all. Thanks so much.
Thank you, Ms. Moore. Would anyone else from the public like to address the Board of Health? Anyone else from the public want to address the Board of Health? Okay, public comment is now closed. Item number 6, purchasing policy discussion. Mr. McGinnis, you were chairing that meeting just prior to this meeting, so would you like to lead the charge on that one?
Yep, I'm the co-chair. Rob was at his county, so I did that. Jairus was here, Shirley was here, and Scott happened to be here early, so we invited him to participate. We benefited from our chief financial officer, our new chief financial officer, providing us with an overview of the whole procedure. I will, in summary, I'll just summarize what we said, and then I'm going to invite others to ask questions directly to the expert. But for starters, this policy conforms with federal and state other policies. It begins with new language that specifically states the legal underpinning of it. So it now refers to Act 368 of the Public Health Code, so that we know where it comes from. And that's different from the current policy, because the current policy does not do that. It is language. I'm going to summarize by saying it is language that the staff understands and can follow easily. It is language designed for the board to be able to understand easily. We recognize that emergencies can arrive, but that for the vast majority of actions within the Board of Health and the Health Department, this policy will be very useful. It will be a good guide for the auditors to be able to look back at decisions that were made. And so it is designed to be understandable, easy to follow, and as a good guidebook. So one of the things that had changed was the change from $20,000 to $15,000 for unbudgeted and unexpected purchases. The dollar amounts conform with other health departments and our chief financial officer's experience elsewhere. Most of the purchasing that goes on within the health department is routine in nature. Some amounts are large, but in the case, for example, of some dental supplies, there are single suppliers. And so this acknowledges the fact that some even large expenditures are only going to have one supplier. In the event there are emergencies, there is a process that allows staff to act and then notify the board chair and then make the decision available to the full board for discussion after the fact. But speed bumps are not created that will slow the process down in the event of an emergency. What's a good description of an emergency? Well, we really don't have one right now because to some extent, by definition, they're unexpected and unpredictable. We don't own a lot of buildings. The example I used was boilers, but we don't really have a lot of that. There are roofs. In Antrim County, fortunately, the health department was wise enough to give control to Antrim County just before the furnace failed. So that was a major improvement, showing wise work on the part of staff. So that's my summary. We received, and I think you did too, a copy that Word produces that shows strike throughs, highlights so that you can see the changes. That's my summary. And we recommended approval.
Thanks, Charlie. Jennifer, did everybody receive a copy of this draft?
I emailed it to everybody and I put a copy on all the board members' table, so they should have it in front of them.
Okay. So, Mr. Marcus, go ahead.
So my question is, not familiar with the whole policy. Anywhere in another section, does it point to the budgeting purposes of purchasing? My question is if you piecemeal any type of purchasing, it ends up spending more money than you plan on from year to year. But during a budget process, you take your collective information from the year prior or even history before that, and you know, based on basically on a plan that you have for the whole year, you know how much you need to order. It's in the budget and there is no surprises. Therefore, this would very rarely be used. Obviously under an emergency situation like constructions. I believe it's important that in a policy, it should always point to specifics like you brought up. If it's not in here, but yet you recognize it as a specific issue, it should be in here since you already know it's a specific issue. So why not point it out or at least list it? My only concern is that when you allow any department, and I'm taking from experience from my own county, any department to have the ability to just do paperwork, submit the order and get it done, it promotes a non-fiscal thinking. You tend to spend more than you really could have. If you would have been a little bit more prudent, you would have went through a different process. So I don't know how to word it, but I think that it's loosely worded and it's a little bit concerning to me because it really doesn't really force you to have to plan ahead in the budget process, but that may be addressed in another page. I just don't know it.
I think, and Shannon, I can let you respond to that, but I think under item number 1, staff submit the form to their supervisor for approval and assignment of the program numbers, budget category, and fiscal year for each expenditure on the requisition. So I think that the budget is addressed by this policy. Shannon, did you want to elaborate further?
Sure, I'd be happy to. I understand your concern and I do appreciate it because I like it when people are thinking fiscally responsible. That's part of my job and I like that. We do talk about, purchases. If you're going to purchase anything less than $150,000, that you need to have 3 quotes from 3 different vendors. I think that's just being fiscally responsible and prudent. Anything over $150,000, we want competitive proposals. And if it's the case of a construction project, then we want a sealed bid and a bid. That's typically how you handle construction projects. So that language is in there for a construction situation. The sole source is a very unique, hopefully we don't come across it very often. I would much rather see, bids and quotes and being responsible. I will say that our auditors are going to look at this and they are going to hold us to this. And if we do not follow this, you will find it in our audit findings and that will be in the report that comes to the board. There is a section in here where we did talk about anything, and I'm glad you brought this up, that's unbudgeted or unexpected. Those are purchases that hopefully we don't see very often because like you said, we should know what's coming into this year. Those would be kind of those exceptions. But if it's over $15,000, we're going to bring it to the Board of Health for approval. We're not just going to go ahead and do that without talking to you first. The only exception to that would be an emergency situation where we bring it to the board chair before bringing it to the entire board because time is of the essence. I don't have a great example of when that might be. I think our IT employee back here, Chris, informed me that one year, one of our offices got struck by lightning and we lost all of our servers and all of our computers were fried all at once. It must have actually hit the building. So that's about the only example that I have of an emergency where we wouldn't know ahead of time or be prepared.
I do have one minor example.
Sure. Yeah.
Laptops that for field people out working. If you know, it's in the plan for every 7 years, you replace laptops. I'm just picking a number.
Mhm.
And within 4 years, you're ordering new laptops. And it's not within the plan of a 7, it's suddenly 4. It falls in that category of under 15,000 because it's like 12,500. And you do it and it's like, why did you do that? You still had 3 years left. So there's my example of where I consider it, where it should be discussed and rather than just go ahead and just replace everyone's laptops because the latest and greatest came out.
So I wish we could do that. Our IT director, Tim over here is laughing right now at me because he handed me a plan to refresh our computers and a number of our computers are over 10 years old. We really only replace them when they physically die,
Oh.
which is not a great plan right now. No, so we are working together he's got a whole list of, if we do a 5-year plan, a 7-year plan, what that looks like. And we're going to slowly phase this in. We don't have all the money to do it in year 1. But can we break that down into pieces and get there? So
Great. That's the plan part was what I was referring to in the whole scope of the whole concern is if you don't have a plan and you're spending all this freedom to spend money, you're really never going to achieve anything.
agreed.
Anyone else from the board have any questions for Shannon regarding the purchasing policy?
Well, she kind of, I guess she answered my question completely. You bring it before the entire board then when you review these expenditures. Okay.
Yes, if it's over $15,000 and we have not budgeted for it and it's unexpected, it will come to the board for approval. Otherwise, our budget is approved by the board before we start the fiscal year. And like I said, the only case would be an emergency where we had time of the essence. And then it would go to the board chair with a conversation for approval. If the chair approves it, then we will bring it to the board at the next meeting.
This has not always been practiced everywhere, so.
Yeah, as a matter of fact, this is that section of the policy is new for us too. We
Okay.
never had that in there. So,
Okay, good.
I think we're, realizing that, we want to have the board, it makes sense for the board to have a little bit more fiscal oversight. And just kind of balancing, making sure that it doesn't, an undue burden to staff as far as just trying to do business versus, taking a lot of things to the board all the time. So we're trying to hit that middle ground, and I think we've done that with this policy.
As we discussed in the personnel and finance meeting, the statement that I made is that policies are guidelines and no one policy is going to cover every circumstance that comes up, but this seems to be a pretty good working draft. I think that we're already seeing the benefit of having Shannon on board as our CFAO, and I'm sure that Dan was happy to have her draw this policy up instead of him. So any other questions for Shannon or Dan? Mr. Rubin?
I would just like to say that I'm very pleased with this. It's more simple than the one we have in Antrim County. And I think it addresses concerns that have been raised in the past. And it also, like has already been said, I don't think we're going to be bringing every laptop before the board to approve the purchase of. So I think it's a good balance, and I'm prepared to make a motion to adopt this policy as recommended by the Personnel and Finance Committee.
I'll second that.
Okay, so we have a motion by Mr. Rubing, a second by Mr. Mason. Is there any further discussion or questions regarding the proposed purchasing policy? I hear none. So Jennifer, we'll have a roll call, please.
Rubing,
Yes.
Marcus,
Yes.
Roloff,
Yes.
Hankins,
Yes.
McGinnis,
Yes.
Coons,
Yes.
Pallarito,
Yes.
Mason.
Yes.
Pass the first test, Shannon. You can come back next week.
Next month.
Item number 7, sanitary board decision notification discussion. I asked Dan and Jennifer to add this at the request of our board chair, who's a Realtor, Mr. Christensen. And what we have run into in a few different circumstances where we'll have a sanitary board of appeals. If there's been a previous variance or a previous decision made about a piece of property, we would like to see that attached somehow to the deed for that property so that when it is subsequently sold, the new owner buys it understanding what's under the ground. I think that's the best way for me to phrase that, but we had one circumstance in particular where folks bought a piece of property. It had received a variance to put in a specific septic system. And then there was a pole barn added, which added 1 or 2 bathrooms. And they weren't aware where those bathrooms drained. And it turns out that it went to a holding tank that had to be subsequently pumped. And they went, okay, we need to somehow make this right. We bought this not knowing that. How do we make it right? And that's created some interesting circumstances for our environmental health folks. So I don't know, and Dan, I'm going to defer to you or to Jeremy if there's a way that we can attach that notification of a sanitary board of appeals decision, at least for Charlevoix County, but I'm assuming that we want to do this in all 4 counties. None of us wants to buy a piece of property and go, oh, wait a second, I need to make this change to my septic system because I just found out there's this issue. So Dan, I know that I threw this at you a day or 2 ago, but is there any thought you can shed?
Yeah, well, I can tell you, I mean, our sanitary code right now gives us the authority when somebody wants to do a alternative treatment system or advanced treatment system. There is a requirement that that is recorded with the deed.
Okay.
So subsequent owners know about it. That's right in our sanitary code. So that's, pretty much spelled out there. I did ask our new attorney, I just sent him an email and just said, hey, we're put this on the agenda. Just wanted to, get your thoughts on this. Does it have to be in our sanitary? Do we have to have some specific authority like in our sanitary code to record something with a property's deed? And he basically responded and said that he sees no prohibition against recording the document and check that out. Also spoke with the Charlevoix County Register of Deeds and they confirmed that. And basically we would just have to provide a document accompanied by an affidavit in which he said he can format and help us create. And I think, with the Sanitary Board of Appeals decisions, those are in a certain format, correct? With the minutes or however that decision is formatted. And that could simply be recorded with the deed for the property and it would help out where it would make a new buyer aware, like you're dealing with the current owner. Maybe they get a decision that is not favorable to them and they end up selling, and it just, basically puts the new owner of the property, just informs them of what decisions have been made on the property before they, get led down a path or just have certain ideas about what they can and can't do. And I think it would be really helpful. And I think it would save the the Board of Appeals and our own sanitarians, environmental staff a lot of time. If people knew about that ahead of time, so.
Okay. Do all 4 counties, Dan, work under the same sanitary code?
Yes, yeah,
Okay.
we have a district-wide sanitary code.
Okay,
Yep.
thank you. Mr. Marcus.
I had a recent, someone complained a few years ago now, actually, but somebody bought property that found out didn't perk, and he didn't know that when he did the general search. It wasn't until he applied that he found out that it didn't perk. And he was stuck with this piece of land that he couldn't build on. So my question is that kind of stuff, is there a way to make that easier for a buyer that when they do a general title search, that will pop up? Yeah, this is just one example of somebody. I have no idea what they did or didn't do. I just wondered what could have went wrong.
Well, and sometimes, I mean, honestly, and we run across this all the time, and especially in the market that we've seen in the last couple of years. I mean, when you have 10 buyers lined up, people are buying property without doing due diligence. I mean, they're not getting inspections done on houses. They're not, because it was like they had to buy it right now, else they were going to lose it. So we've seen that as a problem, but even before that, we'd always lots of times run across some people that would buy property without doing their due diligence, having us go out and do a perk test, so to speak, and determine if the property is suitable. And that has happened, and it's kind of on the, it's on the buyer, at that point. I think making it easier for people to access records, that's been a big goal of mine, and that comes, and I've talked to some of you about this, about digitizing EH records and having like an online portal and having people be able to access them that way. And that is that's a goal of ours. Other health departments are doing that. So that's what I would say about that. I think to be able to record every decision, everything that we do with I don't think that would be, reasonable for us to do, but I definitely can see in these situations where there's sanitary board of appeals, people are going to the Board of Appeals to appeal a decision we made or ask for a variance. The outcome of that, if it's not favorable, that really, I think, is the criteria for when it would need to be reported.
Well, even if they're granted the variance, though, I think that needs to be. recorded
Yeah, I
as
guess,
well.
yeah. Thinking about it, we could do it that way too, just so it's on there.
If we can just somehow attach the decision of the sanitary board of appeals, or if it would go then to the circuit court, if they chose to appeal beyond sanitary board. And I'm going to plead ignorance here on how we attach that to the deeds, but
We've talked about that a little bit internally, and I think we would just, because it costs something per page. And I think we would just need to, have a fee to cover the recording costs, and we would have to record it ourselves, I think. Because I don't know that it would get recorded if we asked somebody that just lost an appeal, hey, by the way, would you mind going on and recording this at the Register of Deeds?
yeah, I'll get right on that.
So I think we'd have to, just whatever it costs. It doesn't have to be whatever the Register of Deeds charges,
Sure.
just so we can recoup our costs on that.
Jeremy, did you want to add something?
No,
there?
I totally agree. I think having some type of fee would be the best way to support it. That's really the only way it's going to be consistent.
So which one of you wants to be in charge of following up and bringing something back to the board? Jeremy, you're elected. Thank you for volunteering. Okay, so it's not a huge rush, but if you can make that.
Yeah, I think we could bring it back to the December board meeting, and we'll do some research and see what it would take, kind of put together a proposal.
Okay.
Makes sense.
Anything further from the board? I'm assuming that everybody's counties wants to have these things done, but I don't want to assume. So if there's anything further from any board member that you'd like to address on that topic. Okay, hearing none. Item number 8, staff reports, Mr. Thorell.
Yes, thank you. So I am going to begin by inviting Carrie Miller, who's our nurse practitioner at the Blue Devil Wellness Center, to come up and speak to the board about, in the audience, about the child and adolescent health centers that we have in our district. Thanks, Carrie. Hi, Carrie.
Hi. Didn't think through when I sat at the back of the room, I have to walk up in front of everyone. So good afternoon. My name is Carrie Miller. I am a family nurse practitioner, and I am at the Gaylord Blue Devil Wellness Center. I have been the primary medical provider there for the last 5.5 years, ever since I started working with the health department. And so today I'm just here to talk a little bit about primarily my center, but give you a little bit of overview of some of the services we provide in the schools. So through the 4 counties of the health department, we offer numerous programming in the schools, and that how it looks really depends on our funding and where that source of funding is coming from. So we have what is called school wellness programs. And those are centers that have a registered nurse and a mental health therapist in those locations. We also have some standalone therapy sites where it's just a mental health provider. And then we also have some standalone school nurses. And then we operate 2 centers that are like mine. We call them child and adolescent health centers. Those are staffed by a medical provider. Right now, both of our centers have a nurse practitioner in them. They have a full-time mental health therapist, and they also have a public health tech. That's my public health tech right over there. So she's along today with me. So the 2 centers that we have operate a little bit differently from each other, even under the same umbrella. So the Ironman Health Center is in Mansalona. They are what we call a school linked center. And so that means they're not on school grounds. They're adjacent to the school, easy access for the students, but they operate under some different rules and laws than what I do because I'm located right inside Gaylord High School. So I am a Gaylord or a school-based center. But pretty much it's staffed very similar, and a lot of the services that we provide are the same. So at my center, I see ages from 10 to 21. So you don't have to be a student at Gaylord High School to come here. I have college students who still come back and see me. I have students that come from Vanderbilt schools, St. Mary's School, Johannesburg, Lewiston, and even this summer I pulled from multiple counties away, even out of our four county area. So we will see pretty much in that age range. I will see siblings that are a little bit younger. If they come with family members and the parents request that I see like an 8-year-old or a 9-year-old, I will do that as well. But typically I see ages 10 to 21. There is no out-of-pocket cost for our services because we are grant funded. A lot of people say that we're free. We are not free. We do bill insurances if you have insurance, and that is how we supplement the running of our program. And we accept pretty much all private insurances and all state Medicaid services. If you don't have insurance, you receive the exact same services, whether you have insurance and we bill that or not. You will get vaccines, you will get physicals, you will get sick visits. We'll provide the same services. There's just no out-of-pocket cost. We don't charge copays. If that is, if they have a private insurance and a typical visit, they have a $25 copay, we're not going to charge that. So we're not free, but we really don't cost anything for people to utilize our services. We provide services year round. A lot of our programming are kind of timed with the school year. So when the students are out, they're out for the summer. We operate year round. So I'm there pretty much 40 hours a week, even during the summer, except when I'm on vacation. Our therapist is also full-time. She works 5 days a week during the school year. And because the need for therapy services seems to decrease a little bit more in the summer, she's only there about 2 days a week. But we still have the availability for mental health services as well. With our therapy programming, we really treat kind of like depression, anxiety, adjustment disorders. And we really say that we see people with mild to moderate illness. We aren't going to see somebody who has severe depression or severe anxiety. If we do get those students referred to us, we will refer them to a place where that's probably a little bit more appropriate for the care that they would need. As far as for the physical health services and what I offer, pretty much kind of what you would find at most clinics, we will do there. We provide physicals, we provide sick visits, we provide immunizations. If somebody is injured, I see a lot of sports injuries at my clinic, concussions, pretty much kind of the gamut of what you would see other places. We don't have x-ray there. We don't have really lab services other than kind of point of care labs, which would be like our strep testing. We can do COVID testing. We can do urine testing. We can do hemoglobins and cholesterol levels. But if they really need anything further than that, we have to refer them out. But our providers, we can order those, send them to outpatient lab or outpatient x-ray if we need that. So as far as kind of filling this need, so having been there for 5.5 years, I can say that we have just really steadily increased our numbers. I can comfortably say that I am probably at the point where, you know, I'm almost overbooked every single day. That when I started there, we didn't have a provider for a small period of time. And so we weren't even meeting really our grant numbers that first year. And we have consistently met those numbers and exceeded them, sometimes by, you know, really significant amounts. So the state asked me to see about 1,000 people a year. And this year we just submitted our numbers and I think I saw close to 1,600. So that, and the same thing with our therapist, she is consistently exceeding the demand for our services. When we look around in our community, what we're seeing, and this isn't just specific to Gaylord, but really in all of our surrounding communities, we know there's a lack of access to care. It's hard to get into your doctor right now. It's hard. So many doctors in our community have left or retired recently. And so, you know, I can only see that 10 to 21. I can't see the whole community. But I can say that really the demand for our services have just significantly increased. And I really feel like we're meeting a community need here. So that's kind of my little spiel as far as what I do. Does anybody have any questions for me?
What laws govern the work that you do?
So lots of laws, lots goes into that. So, you know, not only do I have to follow my scope of practice and I have to follow state laws regarding that, we also work under, for me, being in the school, I have to follow certain protocols of what can be done in school grounds. And then also we have, because we're grant funded, we have to follow and stay under the strict umbrella of exactly what we're allowed to do. So there's kind of a loaded question because there's lots of pieces to that,
Yeah,
but we're very regulated.
my wife's a retired nurse, and I know that nurses and physicians are required to report certain things if they see them. You have a requirement that must be identical to report certain things that you might see.
Absolutely, it's the same law. Mandated reporters, same thing that anybody in public service really has to follow who is seeing children.
So I think you addressed this. So you provide different levels of service to different schools and different districts based on what grant funding is available?
So
Or mean you haven't
when
done
I
it
say
for-
that I provide those services, I
Yeah.
stay in my little clinic
Yeah,
at the
I
school.
guess I meant. that.
But really, and I speak to like the summer because I'm still recovering from the summer a little bit.
Mhm.
The demand for physicals and clearance for sports, because that's required, has just been, it's hard for people to get kids in. And so I was getting people from all over pretty much northern Michigan. I even ended up with several people from downstate
Yeah.
who were calling around trying to find a location to get a physical done.
I guess, so the Blue Devil program is your program, but say,
Yes.
is there a Raider program? Or is there a-
So
program?
we do have a Rambler Wellness Program, which is a school wellness program. So that's one of those locations that has an RN and a therapist. The only other program that we operate that has an NP is over in Mansalona at the Ironman Health Center.
Thank you.
Yeah.
Mason, go ahead.
So when you speak to vaccinations,
Yes.
now we've expanded into COVID and maybe Dr. Meyerson could answer this for me. What's it been 30 or 40 years ago that we started with flu vaccines?
Yeah.
It's fairly recent.
It's been a while.
Yeah, well,
More.
but gosh, an awful lot of people out there have managed to survive in life till 80, 90, centurions, 100-year-old individuals, never knowing these vaccines. Is there anything that this board can do? This must be part of your workload. Would that help reduce workload? If we could remove these, we tend to want to encourage people to do these things as though it's necessary. Is there any way we can back off these programs and neutralize these animals that keep popping up, especially with COVID?
So the demand for vaccines for me is based upon need. You know, I'm not out there consistently trying to pull people in to vaccinate them. Parents call me and ask for an appointment for things. And so what I'm really busy and that tends to kind of come and go depending on what's going on. Right now, I'm working with our school because their health occupations class is required to have a PPD skin test and a flu vaccine prior to going to any of their rotations. And so I'm working with them. They have the choice to see me or they have the choice to go to any place that they want to. It's not required that they see me being I'm in the school, but we try to ramp up our services based on what's going on around us and what the school needs of us. And so that's one of the examples. The last couple of weeks, I've also been working, 11-year-olds need vaccines prior to going to 7th grade. And those are school required and the state and the schools have to report on those. And so I've made myself available with flu clinic, or not flu clinics, but these required vaccines with clinics. And I make sure that I have the inventory there. And I work with the school to set aside certain appointments so that I can help kind of meet that need so they can get what they need. The students can get what they need without having to wait months. And so we think really it just kind of varies, I would say. So I don't think taking some of those away would change my workload. I think it's more just kind of being there and being in tune with what the school is needing from me and what our community is needing and trying to do that.
Any other questions from the board for Ms. Miller?
I guess I've got one more. I was looking at a different report that was from Holly, and it talked a great deal about informing Medicaid eligible children about the benefits and families about the benefits. I sensed from this that there's an educational component that people don't fully appreciate the benefit
Yeah.
that they have available. Is that correct?
Yeah, so back to kind of where I was talking a little bit about how we bill insurance. So we're always evaluating that. And if people have insurance, it's great, we bill them. But if they don't have insurance, then we have several programs throughout the health department, including the public health tech, that we can help them work through and navigate and find insurance
Are
if
you
they
finding-
want.
Are people denying care to themselves because they don't have insurance and don't recognize that Medicaid is available for them?
So some, and then we also have a group of people who don't qualify income wise for that, but it's, you know, and if they're not getting insurance through their work or it's not offered in other avenues, that's where I really feel like our center has played a big role as well, because we see those kids and we still provide access to care for them. They get their physicals, they can play sports, they're getting their well child exams, they're getting immunizations, and they're staying current. And so we do see a lot of students like that, where we offer the assistance to try to help them either on the marketplace or help them with a Medicaid application. And they don't need that. But it's on our radar, and everybody who is uninsured, we monitor and track and offer assistance.
And you said part of your issue is the lack of availability of healthcare professionals in the communities you're serving.
Yes, we're really seeing that in our area, and I know it's surrounding communities. It's not just Gaylord. I think it's kind of the state of healthcare right now in general. But I think when you're kind of front lines and you're hearing all these stories every day and you're seeing it, it's my reality every day. And so, you know, I'm very grateful I'm where I'm at and I'm able to help meet that need, at least for that small group of people that I see. Right.
Anyone else?
All right. Well, thank you very much.
Thank you, Carrie.
Thanks, Carrie.
Dan, you want to move on now to written reports?
I would like to talk a little bit about this, just so the board is aware of this additional funding that we're receiving from Eagle, because it's not something that I get to say very often, that we're getting additional funding from the state. So they are, Eagle is getting some additional funding that's kind of centered around drinking water and drinking water safety. And this is through the general fund. We're going from where we were at 2.8 million to 6.3 million spread across all the health departments. And really, as written in there, we're getting a bump in what we receive for public pools, campgrounds, and then long-term monitoring where we're sampling contaminated wells or wells that are near contamination to monitor and make sure that the contamination is not spreading or, detected if it is spreading that way, which is very important, especially we do a ton of samples related to the WIC or WIC's TCE plume would be an example. And then probably the biggest impact we're going to have is through our non-community water supply program, which is type 2 wells. They're water supplies at restaurants, small factories, businesses, hotels use when they're not supplied by municipal water supply, when they're out kind of away from those areas. But we were like number 4 in the state, I think, for the number of type 2 wells that we have. We're close to 500. And so this additional funding, basically will go from about 96,000 to 280,000 in funding, which will help us really monitor that program, because over the years, really in the past 6-7 years, we've really gotten a lot of extra requirements put on us from the state, unfunded mandates, if you will. And I just want to acknowledge that that we're getting that extra funding, and we're really excited about having that to enhance that program. I was part of a work group this summer that met quite frequently, and we asked for much more to make this program really run like it should. And that is still on the table, but this is a start, and I just wanted to share that with the board. And then also, I think I mentioned to a few members, but we chose a new attorney last month, and just wanted to let everybody know that he was planning on attending this meeting, but was not able to because of illness, and will be here next month. So, and also the Mansalona Family Resource Center is got a new roof. So that's something else that we talked about. So, and just wanted to also update you really quick on the meeting that we had with the Department of Health and Human Services. They are basically going around to all of the health departments in the state, meeting with folks. And like I said in the report, there was a lot of discussion about things that happened during the pandemic. They were really our support consultants from the state through MDHHS that were the liaison with the governor's office and everybody else that we're working with throughout that whole emergency. And some of the lessons learned were really centered around communication, because we would get we would be working off something that we learned 5 days ago, and then get some new information from MDHHS, and then the governor would come on in a press release, and it would be a complete 180 of what we just learned the day before. So there was a lot of that kind of discussion about just all that, craziness that was going on, and problems with communication. So, and just really wanted to let the board know too, we had some really in-depth conversations about funding, because what we're seeing from funding from the state, it's very siloed and it's very stagnant. So in all of these programs that we do, funding's been flat for years, and our costs just keep on, going up and up and up, just like everybody else. And, we really wanted to convey that to them. So, and then the other thing with siloed funding, you're just very restricted in each of your programs of what you can do. You can only do certain things with the certain bucket of funding that you get, even though you have somebody that maybe works a little bit in each one of those programs. So just some things that I just wanted to make you aware of that we're working on, and just trying to make things, more efficient and easier for us, and, make it easier for the public to use our services. So.
Okay, very good. Mr. Rubik.
Yeah, you said we have about 500 wells. What's the biggest time? You talk about adding staff. What's the biggest time commitment for that program of non-community water?
So right now, just to give you an idea, we have one dedicated, each health department has a type 2 coordinator. And depending on, I mean, there's some health departments, they only have like 20 wells. So it's just a small piece of what they do. But we have a dedicated person. His name is Scott Johnson. He works out of the Gaylord office and he oversees all of the wells that are in that program. And there is a tremendous amount of monitoring that has to happen. All the owners of these wells have to take samples all the time. And these are a lot of things that have been, a lot of changes have been made over the past 5 or 6 years that require much more sampling and much more tracking of that, so to speak, and data entry and all of those things. He's supported by a administrative assistant office coordinator that in the Gaylord office that helps him with that program and does a lot of the data entry and data management. Because that's really, I mean, what that program has turned into. His big complaints is he's not out there looking at the wells, looking at the facilities, making sure there's not problems or cross connections and things like that, like he used to be able to do, because he's so bogged down with all this reporting, the reporting requirements and everything else. So we're really hoping, looking at that we're able to do more of that and just really get more staff time in that program to do it right. I guess I would just say, like, when we go to a restaurant or, you stay in a hotel, you have an expectation that if you get a glass of water, it's going to be safe to drink. And that's really what we need to make sure of through this program.
Yeah, my only comment is, we keep, and it doesn't matter if it's this one or if it's the County Veterans Affairs, we get more rules and more regulations and more red tape that we have to follow. So then we have to hire another person. And every time we do that, we're taking it away from the private sector, because these jobs are better paid and better benefits than most private sector jobs. And then we have the Pizza Huts of the world and the gas stations and the motels who can't hire enough employees anymore. And we have a labor shortage. So wherever we can, I like to encourage us to be efficient and to try to do more with less, like every other small business in Northern Michigan is doing. So I know you understand that, but
Yes. Yeah.
it seems like we've got this situation where we constantly get more rules and then we have to hire more people to follow the rules, and we're not sure if we're any better off afterwards. And we just suck up a whole bunch of hours that someone could be doing something else.
Well, I don't necessarily disagree with you on some of what you're saying, especially the rules and not getting, I guess our biggest complaint is that, we continue to have to follow more and more rules and deal with more situations and not get the funding that we need to do it. So I don't know, from my own experience, there's nothing worse than feeling like you're just keeping your head above water and you can't do a good job, so, and if really, in this program is the poster child for unfunded mandates. It really is. So, and it's been like that for several years. So I think, getting
Mostly state mandates, or are they federal too?
mostly federal,
Okay.
right? And then we do have some state mandates, really mostly dealing with PFAS, with public water supplies. So it's not that, the intent is good. But it just adds a lot of work, so to speak.
Okay, are there any other questions from any board members for either for Dan or any of the directors who submitted reports? Mr. McInnes.
As always. When my wife was a practicing nurse, she commented that smoking was so addictive that people in the hospital would smoke their cigarette through their trach tubes. And I say that because Dr. Meyerson has focused on smoking in his report, which I appreciate. And the question is, you pointed out that the money that comes from the tobacco companies is engulfed by their advertising and isn't used for cessation. The question was, smoking being so addictive, what would more money do, just out of curiosity?
getting people to reduce their smoking rates is multifactorial, right? There's a lot of things you have to do. So I think the recommendations for the funding to try to reduce tobacco use in your community would go towards lots of different things. It can be marketing to try to counteract the marketing. I mean, that's tobacco marketing. They spend $298 million trying to get people to use tobacco. It's pretty, advertising works. If it didn't, they wouldn't spend the money on it. I mean, they have the metrics. So we know that marketing has effects. And if you can counter that with your own marketing, there's been different things that have been done. Some work better than others. So you have to kind of learn, but there's a lot of things you can do to try to help, make tobacco use less attractive. And I think we saw that for a while where tobacco use for many years was decreasing in our adolescents. And we saw, slow, but a consistent trend in a decrease in tobacco use in adolescents, which to me was exciting because that meant, eventually we're just going to be a community of non-smokers because, we're all going to die and they're going to replace us and they're not smoking as much. And then along came, vaping and electronic cigarettes. And we saw with marketing what that did and the teen rate skyrocketed. And you can see, with this perinatal data, that's what I kind of show. I look at that. We were making some headway there and now we're not. So that, for some people, electronic cigarettes and vaping might help reduce their combustible use, but we're seeing it being so popular in adolescents that some of them are going to become dependent on tobacco. And that's why you then see the perinatal smoking rates and the problems that we have up here. Other funding can be dealt, lots of things, smoking cessation classes. We know it's difficult to stop using tobacco, but there are evidence-based things you can do to reduce tobacco use. But it takes time and energy and effort on people. So it takes funding.
Okay, thanks.
Now your graph here on perinatal smoking, my eyesight isn't good enough to distinguish 2014 from 2020 on your bar graph, but I'm guessing the 2014 is on the left. Is that
right? Yeah,
okay.
The time goes left to right. It is a busy graph.
And then the vaping, you're seeing a 2 to 3 fold increase, 7%. Is that per year or?
No, that's just the vaping data that I could get for perinatal use. It was not tracked as much as smoking. So, but what the little data I could find on perinatal vaping use is that it has increased in that 4-year period 2 to 3 folds and is now at 7%.
When you say perinatal, what is that a specific age range or?
That's women who are pregnant.
Okay. Yep. And that's terrible high for all of our counties. When you consider a third of unborn children are being influenced by drugs before they're even born.
Right. And I think why I put it to all of you is to know that we do really well in a lot of health factors. And you look at county health rankings, Northwest Michigan comes out looking pretty good in a lot of different health factors. But unfortunately, this is one area where we kind of lead in the wrong way when you compare us to other parts of the state, especially when you compare it to the more urban, suburban, larger population centers. We have a lot of work to do through a lot of different ways. And we are doing, we try it the best we can, but we still have a lot more work to do to address this issue.
Have we ever tried taking a small sample, say a school district or a half of a county and spent some money and inundate it with anti-smoking information? Have we ever tried anything like that or?
Well, we've done lots of different things. I think you've heard about our SAFE program, that's in Emmett and Charlevoix. And now we have the RISE program in Otsego. And they've really tried to address that, from a marketing perspective per se, using kids, peers, peer leaders to try to influence choices and trying to help kids, not go towards using tobacco use, that it's not necessarily a popular thing to do. So, and they've done all sorts of different initiatives, whether it's, commercials that show at the movie theaters, nights at basketball games, things like that. So we have, that's just one small example of what they've done.
Right. I guess my question is, have we looked at the data when that started, when SAFE started? And can we tell that there's a difference? In other words, would it be worthwhile to, I just know my hometown, Ellsworth, I don't think they do a lot. But if you can show me some data that says, hey, we started SAFE in Gaylord in such and such a year, and smoking in teenagers dropped by 5%, okay, that's showing that there's value there. You know what I mean?
Yeah, and we do. And that's where that one graph I have, the SAFE in Northern Michigan region, I tried to do that. There's a lot we could get into the data more and what's good about it and what's bad about it. And where, the sources of the data. But when you look at vaping rates, we do see differences, in different counties. And I think over time, hopefully we will see some positive data there.
Mr. Marcus. Just to follow up on this is one of those things that always bugged me. I owned a business. I sold tobacco. When vape came out, I refused to sell their products. And my kids would get so mad at me because they thought I was just being old. One of the problems you mentioned here and there, the amount of money they spent at the federal level, that's a direct impact of why the guidelines are not being set forth for reporting things that are lung-related diseases that should be required to report why. Back when, I don't know if it's even true or not, but people talked about popcorn lung as a result of vaping. And that, I think, was spread through social media, and people got scared and said, whoa, this might be a real thing. We should stop. And then slowly the counteractive pushback from the industry started developing. And then all of a sudden they started not believing that stuff. Oh, that's all BS. That's not true. You're making that up. And I know somebody who actually did get really sick and had some lung issues that were related to the popcorn lung phenomenon, I'll call it, because I don't know what the better term is. But my point of even pointing that out is every county has a different program. In Antrim County, they utilize the DARE program, which it's fledgling. It's based all on volunteer money. We don't budget any money on it. It's only a small group of kids, a certain age group. It doesn't expand into the high school group where the real peer pressure takes place. And through SAMHSA, which is like a substance abuse, I can never get it right, Substance and Mental Health Abuse Administration, is that right? I always get it screwed up. Services Administration, there we go.
Mental health services.
They provide tons of materials that these organizations could use, and I know they are using them in Otsego. I've seen the kids distribute them amongst their classmates. Can the health department team up and partner and add materials, money, programs, services, whatever, to help those individual school programs, in addition to Antrim County's DARE program, which is, like I said, narrow mind, narrow scope. I know they have a teen program that's being rolled out too, which is a little bit different. It's one of those things where I always felt like there's always more that could be done, but doesn't happen. And what do you think about that?
We're always looking for ways to collaborate with other people to help promote health.
Does it rely on the sheriff to say yes? Because in our case, the sheriff is the buck stops with them. Programs come and, live or die, whether or not he gets.
Yeah, I think a lot of it, it has to do, there's these funding silos. Yeah. And if we can collaborate
Presentation
more,
to the
we
Board of
might be
Commissioners
able to do more.
about what you can and will do will make a big difference.
Yeah.
Anyone else?
I got a couple.
Rubin.
Yep. On Holly's report, she talks a lot about Medicaid and getting people signed up for Medicaid. And I guess my caution there is I took a class about a year or so ago on suicide. And one of the highest rates of suicide was during the Great Depression when men didn't have jobs. They couldn't provide for their families. And I understand that it's trying to be helpful, but when you look at mental health, especially for men, they feel a lot more valued and important if they're able to provide for their families. So signing them up for Medicaid or Medicare defeats that purpose. It makes them feel like they aren't necessary because the government will take care of their family. And so I just think we should be trying to get people off of that and working and contributing to society and teaching parents to be providers and responsible for their kids.
Sure. So the overall emphasis of Medicaid outreach is for us to be able to leverage dollars that is provided locally through local appropriations in what we call a Medicaid match. So yes, we are able to use these different categories of outreach to sign people up for Medicaid insurance. And, you know, a lot of times it might be they are facing other barriers within their life, and that's why they're not able to have adequate housing or a job or transportation. So when that, I mean, would be wonderful if everyone that is Medicaid eligible then is eventually able to have a job that, you know, provides insurance, or, you know, where that family is self-sufficient. But we are, you know, a safety net organization. So people that are uninsured or underinsured, we're able to help them get through maybe that hard time, or that single mother or single father for that matter, and really be able to use that outreach money that we're able to recoup. So for every dollar, you know, we're able to make it into $2.53 to be able to help these families. So that's really kind of ties back to that community connections program and all those different determinants of health, you know, housing, transportation, food insecurity, that we're able to get those people signed up for these different programs, Medicaid eligible programs, whether that's actual health insurance or that's transportation, or, you know, there's a whole gamut of differences.
Yeah, the Michigan Department of Health and Human Services gave a report to the Antrim County Commissioners a month or so ago. And she said that since the onset of COVID, they haven't taken anyone off, and that off of Medicaid or Medicare, and that her best guess is there's over 1.5 million people in the state of Michigan that are on that shouldn't be on anymore. And that even if we start taking the people off that aren't supposed to be on, it's going to take us at least 6 months, because each case has to be looked at, it has to be evaluated. There's some people that can't be taken off for, you know, like you just talked about, but the people that can, we're just, it's just bad.
Okay, Mr. Mason.
Capping something that Jared had mentioned earlier to Dan concerning the find my page here. Well, going back to about 2004, we were a small business processing sand and gravel. We had a wash operation. We dug the pond that supplied the water to the plant. About 2004 or 5, the DEQ made the requirements that required a fee, even from not only car washes, city entities, other municipalities, testing the water for the restaurants and so on. Had probably been in place for years earlier. I think our first year or two, we had to pay $1,500 a year to have them test the water, and I contested that. And they came to the gravel pit. I said, you look at that water and explain to me how we get contamination in our groundwater. He couldn't answer that. In February of that year, the following February, the soil district put on a class for gardening down the Grayling. And individuals had asked the question, well, where can we get the minerals that you're speaking to be used in our gardens to supplement the soil, boosting the soil? Those instructors, so this is very broad based. They said you can go to any gravel pit anywhere in the state of Michigan, and the wash out of their gravel, which is fines, which is basically a clay sediment full of minerals. The wash out of their gravel or the crush out of their rock could be used to make an excellent amendment to the soil, which states in itself that there is no reason to test. Many of these tests that are going on are bogus. They're not a necessary thing to, there's no reason, there's, the city of Gaylord was paying at the time that we had to pay $1,500 as a small business for that. The city of Gaylord was having to pay $8,000. A year and a half ago, it was 19,000 something. Now it's over $20,000 for those same tests. And I would like to ask, where was DEQ, since they've been managing the water systems in the cities for several years prior to 2004? Where were they when the Flint water crisis developed? Where was their testing? And the fact is, many regulations, Dan, are well over the top. And small businesses will not be able to afford that in the near future. It's nice to see these are some huge increases you're going to see in these applications or these permit fees that the DEQ allows for. And with the tightening of the hyperinflation and et cetera that we're seeing, that's really going to hurt people. I understand your need for more money, but many of the regulations I have to question, are they even necessary? At least to the extent that they're being carried out. Are you seeing a lot of contamination in these restaurants and so on in their water supply that would show that they need even further permit fees and regulation oversight?
Well, I guess first of all, I'll just say that as far as I know, the fees are in the Safe Drinking Water Act. And that was established in 1992 or 93. And those are tied to like any increases in those fees is tied to like the Detroit CPI, like Consumer Price Index. So that is not changing. So we are just simply, the state of Michigan has appropriated through their budget process to give us more money to manage this program, or give all the health departments more money to manage this program. So there should not be any increases to the business owners, which I think is good, right? I mean, and they pay an annual fee for each one of those wells. And I think I don't know the exact number. Jeremy, do you know what that is? I think it's 600. Yes. Yeah. So I think it was around $600, and it's been pretty stagnant. It's been that for a long time. A little bit different than what you're talking about. I think you were probably talking about MPDES permits for soil erosion and the wash water coming out of.
This was, in fact, when I had a test made of the water in the pond.
Yeah.
And 0 was the number that came back from the test.
Yeah.
For contaminants. But I asked for petroleum and chemicals, since I don't know what else in the soil that the DEQ could justify as reason for. And so these things are.
Yeah, and that's a
out of
different,
control.
right? And that's Eagle, well, it was DEQ, now Eagle. So that's, they have like many different programs, and we're not involved with that, thankfully. So with this program, I mean, this is strictly drinking water that comes out of wells. And as far as your question about, are we seeing problems? This program is really about regular monitoring, and thankfully we have pretty good groundwater, drinking water. And what it's about is really monitoring on a regular basis. So when a problem comes up, we can deal with it quickly, right? So someone doesn't get sick. And that's really what the crux of the program is prevention, monitoring the drinking water supplies, because the public are using, they're drinking out of those water supplies. And like I said, they should have an expectation that they're going to be drinking safe drinking water, and doing that regular monitoring is really what the program is about. And we do catch problems, from time to time. It's not, a lot of problems, thankfully. But when we do catch them, and then we can address them. So hopefully that answers your question.
Yeah.
Okay.
I got a couple for Jeremy. I see your graphs show the first through the third quarter. And I'm guessing that's because in the wintertime we don't get permits.
Yeah, so I went from January 1st to September 30th. That's usually this year, they go, construction's still going on. But most of the time, it'll slow down after. So I wanted to at least get the business time for permits.
Yeah, I guess one of my questions is, let's see, it's the second to last page. Antrim County, on existing system evaluations, do you know why we're so much higher than the other three counties?
A lot of houses on the lake, maybe they're doing a lot of remodels. A lot of times on an existing system evaluation, they'll usually want to increase bedrooms in the house. And so, unfortunately, I would say that's probably, the majority of people that have the existing system evaluation. I know Charlevoix County probably has some too, but as far as the answer, maybe that's more, more space, they can actually do that. Charlevoix County may not have it. Lots of people. I don't know.
Yeah,
Can I follow up with that with the possibility? I was wondering, is those permits as a result of inspections maybe causing it to go up? Because there's like sale inspection requirements.
Yeah,
in certain.
well, that could be too. I forgot about that. So there is real estate transactions too. But I don't know what, I would say, well, actually in 2020, that probably could have caused some increases. And in 2021.
And so Milton Township, that time of sale ordinance, that would be, those numbers would be included in there too. And that's roughly in the 50s typically, I think. Yeah, 50, 60.
So that'd be 50 of the 140 right there.
Right. So that would, yeah.
And then on your last page, you got a diagram where they're all broke out. Do you have data for 2022 or?
It would just be the third quarter because we're not finished. So, I mean, if you look at the first page, the first and third quarter 2022, that's the data. Except for, well, not for all counties, but if you added them all. I didn't want to use it. I just wanted to.
I think normally when we come back in the winter months, we'll show like the data for 2022 after the year's closed out, pretty much and add that to the graph.
So this last graph is the entire year and
Right.
and the first graphs
Right.
are just the first three quarters. So that's why it's not. Okay, that makes, yep.
Consistent.
And then on Amanda's report, this year we had approximately 173 families involved in Healthy Futures. I was just wondering where we'd been in the last couple of years and what the difference was at roughly, if you know.
The 2 years prior, we definitely were lower than that, probably in the low 100s for that. We were higher than that into the 200s pre-COVID.
Okay.
But with that, the Healthy Futures program is expanding. And so to include like McLaren as an example, it started out as a Munson affiliated program, but now really our newborn home visit program and our Healthy Futures can span into Emmett County as well under that umbrella of Healthy Futures. And so we hope to continue to kind of get that back up again. But this definitely is a program that we would love to see every single woman that delivers in any of our counties, because it's really just that continuation of services when they get back out into their home 3 to 5 days after delivery. And so it is one of those gaps that we continue to strive to increase.
Yeah, I was just noticing that the mother infant health plan, the goal is zero health disparities, and it's just quite sad that a number of these kids, their moms smoke. So from the moment they're conceived until they're born, they're under that influence. And that's a huge health disparity that they have no control over from that very moment.
Anything further? Item number 9, committee reports. We have a accounts payable sheet.
I move, we make a motion that the finance committee met and recommends approval of the October bills in the amount of $735,075.81 and the October employee expenses of $24,413.29.
Is there a second?
I'll second that.
Moved by Mr. McGinnis, seconded by Mr. Pallarito. Any further discussion?
Yeah, Charlie, do you know anything that stood out to you or anything? When we do the bills in Antrim County, part of my job as the vice chair, I'm supposed to look through them and make any observations that.
We had the discussion was brief. There were, if I kept notes, I would be able to do that. And I'll make a point of that for next time, because Rob and I usually, and Shirley has a question or two. Nothing was major, but honestly, I can't remember anything that stuck out. But I mean, that's a good question that I should have prepared for if I thought about it. So
I'll ask you again next month.
I'm ready.
No, there weren't any out of range or out of the normal expenditures that we normally don't see.
Yeah.
Jennifer, can we have a roll call, please?
Rubing,
Yes.
Marcus,
Yes.
Roloff,
Yes.
Hankins,
Yes.
McGinnis.
Yes.
Coons,
Yes.
Pallarito.
Yes.
Mason.
Yes.
Covers Personnel and Finance Program and Evaluation Committee has not met yet, which moves us to item number 10, public comment. Same rules apply, ladies and gentlemen, if anyone would like to address the board. Yes, ma'am. Please come to the podium, and state your name and where you live. You have 3 minutes.
Thank you. My name is Pat Freilich and I live in Emmett County. And, a lot of opinions have been expressed here today about many issues. And there are frequently more than 2 sides to an issue, sometimes 3 or 4 sides. So I just want to comment on a few things. The CDC recommends many vaccines, but that doesn't mean they are required. There's a big difference between being recommended and required. And parental consent is required for all immunizations for individuals age 18 and under. None can be given without parental consent. The state health department and the local health department have a responsibility to provide information on vaccines so members of our community can decide for themselves what vaccines do they want or not want. But the health department's role is to provide that information. And when the nurses are making newborn home visits, it's important to provide that information to parents too, because they have a responsibility to decide what they're going to do for their infant. And there are many sources of information on vaccines. We are but one source. And, I also agree with the point that parents do want to provide health care for their children, and they don't want to rely on the government. But when parents work 2, 3, or more jobs and they can't afford health insurance, because that's the reality of our culture and our society today. And when their children have a toothache, or they've got nursing bottle mouth and all of their front teeth are decayed and they're on antibiotics, but it's not going to take care of it until they get to see a dentist, or they have other health issues, getting Medicaid for their children helps a parent provide for their family. And they want to be able to do that too. That's the other part of it. So those are my comments. Thank you.
Thank you, Ann.
Thank you.
Anyone else from the public that would like to address the Board of Health? Hearing and seeing none, we will close public comment. Commissioners update. Mr. Rubin.
Yeah, I guess I got a question for Dan. We had a gentleman here that spoke earlier about a system that his parents set up and the property was transferred to him. I'm guessing that we're trying to work with him and get him a well that he can use. I mean, can we comment on that or?
Well, I think it wasn't, and Jeremy can jump in because he might know more than me about it currently, but my understanding is it was, the gentleman wanted a well, and then when we went out to the site, seeing the camper using this septic system, that was not something that was allowed per our code. And I believe the decision was appealed. Correct, Jeremy?
Yes.
Yeah.
And the decision was already made that he doesn't have to go to court. He can just get a septic system. He can, he had a change of use. So he put a camper on site, and they're based on that, he would have had to upgrade his septic system. And he was appealing to keep the system that wasn't up to code to the Sanitary Appeals Board, and the Sanitary Appeals Board denied it.
Okay.
So.
And then my second thing was, have you heard any more about the opioid money? Our county informed me that one of the counties, Ottawa County, has submitted a challenge to the handoff of that money. And so it's unsure at this time. I was just curious if anyone had any more information.
I honestly I have not heard anything, but I'll look into it.
Thanks, Dan. Mr. Coombs.
Yeah, thank you. So having spent significant time in my life in places where drinking water can't be taken for granted, safe drinking water, I appreciate the fact that we have safe drinking water here. I appreciate the fact that we have standards, and I appreciate the health department's role in enforcing those standards. Thank you.
Thank you. Mr. McKinley.
I have nothing, but thank you for asking.
Absolutely. Ms. Roloff.
You don't want me to get started.
You're right. It's 10 after 6. I probably don't.
I would like to thank everybody that's attended the meeting today, and I think it's quite a good meeting. And the group up here, the members, I want to say thank you too for all you doing. And I'd like to just say welcome to Mr. Moore. No, you.
Henry Mason.
Mr. Mason.
Mason, I'm sorry. I can't see that far. He was
That's a
my
good thing.
glasses.
That's good.
But anyway, thanks for everybody coming and attending today. And thanks for the health department, all they do for all of us.
Thanks, Shirley.
Thank you. Mr. Mason, do you have any comments?
Jared spoke to sugar a month ago. And my own experiences in life, I've cut out a huge percentage of the sugar. And going back to, I believe it was 1910, was a study that showed that the average person probably consumed 20 pounds of sugar at that time. They probably had maple syrup off the farm and honey that people didn't record because it would have been federal records kept that would have shown shipped and sugars and so on that they're using. I went into Chinese, ancient Chinese medicine. It's a terrible thing to do. To cleanse the body of the gallstones, which are formed basically from the cholesterol of sugar, the use of sugar, and coffee aids in the creation of cholesterol. It's called sensitive liver. It's not to be confused with liver disease. And boy, there's a difference in the little lady, Julia Chang, who came from China, had a health store in Canada. And she said, did you know, I'm sure there are induced heart attacks, that all heart attacks, all sugar diabetes, high blood pressure, etc. So many of these things are rooted in the cholesterol, the gallstones that block the liver's function. Halitosis, all of these things are part of the body trying to rid itself of the toxins that cannot be removed through the intestines until the blockage of stones is removed. And of course, Dr. Miners referred to operations removing the gallbladder. Chinese have done it for at least hundreds of years, just by, it's a pretty tough thing to do, olive oil and lemon juice. And it's not just this, the fact that we consume so much sugar. I'm wondering if even 120 pounds is anywhere near accurate. There are those studies of what, 10 years ago, talking about 120 pounds of sugar a year to the average person. I've seen a study somewhere, and it's probably much more than that. And it's pretty tough to get rid of that addiction. Still working on it, and I'm probably somewhere around 14, or I still have fun, just don't use ice cream, no soft drinks. It's been a long time since I've had a cookie, a candy bar, and you do overcome these things. But this is where the health department perhaps needs to work, because we're going to spend fortunes in supporting these programs. And the real answer is the individual taking care of himself. That's pretty much it.
I got my candy bar right here.
Yeah,
Now I feel like I need to apologize for the candy. It's
yeah,
leftover
that's
Halloween
good.
candy.
Well, a month ago, you only ate one cookie because it was reported.
That's correct.
I didn't have any cookie. I gave it to the youngsters.
Thank you. Mr. Palladino.
Just wanted to say thank you to the health department. That Commissioner Mason and I both joined the health department table at the Otsego County Community Breakfast this past week. Thank you for the invitation. We had a good time. We did not eat donuts, or we didn't put sugar in our coffee. It was just black, so it was we were safe. So
As a former cop, I would think you've broken some state laws there.
we had a good time. We had good conversations, and I learned about things going on in Otsego County.
Thank you, Rob. Mr. Marcus.
Nothing for me other than I have no sugar guilt whatsoever. I consumed at least a pound in the last 24 hours.
Okay. I have nothing to add, and I would take a motion for adjournment. Thank you, Mr. McInnes. I'll second it. Anybody in favor? I'll say aye.
Aye.
Thank you. Good night.
You're all getting broccoli next month.
No. Except me.